Well, joining us now, Adar Poonawalla of the Serum Institute. Covishield has been cleared after a long time. It was cleared in the United Kingdom some days back. It's now been cleared in India. And this is huge news for our country because these drugs will end up saving lives. That's the bottom line over here. Adar, thanks very much for being with us. How many vials at this stage do you have ready to be disseminated?
Yeah, I mean, it's been a huge relief now that we finally got the approval and we've got more than 50 million doses available. As soon as the government of India lets us know where they want it shipped out and, certain other formalities have to be processed and a signed contract has to be there. In this week, we're expecting all these formalities to be completed in the next 7 to 10 days and a very quick rollout after that, and we're hoping to reach 70 to 80 million doses of actual supply in the next 1 month, maybe a month and a half at the most.
How easy or how difficult will it be for you to step up manufacture from here onwards, assuming the paperwork is done, right? And you need to obviously step up manufacture. How fast and at what rate?
So as I said, after March, we can double our monthly output. But it all depends on the easing of restrictions that the government of India puts on us, and we'll have to go by their guidance and wisdom, because they have said that we cannot export the vaccine or give it to the private market. These have been our discussions at the moment, and I respect that because they want to give it to the vulnerable people. But that also means that any common citizen today who wants to buy it or get access to it, or a corporate who wants to vaccinate their entire workforce to bring them back safely to work can't do so until the government has got enough doses to vaccinate the vulnerable healthcare workers, the elderly, etc., etc. There are only 3 vaccines in the world who have proven efficacy, and which you need to do in 20 to 25,000 people. And even there are other Indian companies doing that at the moment currently, and we'll wait to see their result and score. But it's Pfizer, Moderna, and AstraZeneca, Oxford. These are the only 3 vaccines which have proven to work. Everything else has proven to be safe, just like water is safe. But the efficacy, to know how well a vaccine works, 70%, 90%, 80%, has only been proven in these 3 vaccines.
Is there any clarity, Adar, on who pays for it? Who pays for the drug?
Yeah, so we're giving it at a very special price to the government of India at 200 rupees for the first 100 million doses. Then there will be tendering, and then different prices will be available. But let me just say, whatever we give to the government, they're going to provide it free to the people of India. And when we subsequently sell it in the private market, the MRP is going to be 1,000 rupees, which means that, the company gets 500-600 rupees. The distributors, doctors, and others in the normal distribution channels get to get a little margin there and do it that way. But the final customer pays 1,000 rupees per shot.